Hi, it's Davey Deals, and today we're going to talk about advocating for the stroke victim. One of the things that's happened is because I've had a stroke, and something else that's happened is uh, is that people have a tendency to they worry about you, and they really seem to care about what, uh, what's going on. Like, for instance, if Eileen, um, these girls. They grab hold of my shoulder and push me back and forth. So um, that's the way that is. One of the things that's happened is lack of language. My like with my dentures, I keep speaking the S's whistle in all the things, and it feels like my cheeks are a little bit uh, a little bit wobbly, so to speak. They feel like loose, like loose. My cheeks are loose. So another one is uh, the 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 uh, the the thing that happens is you have your mouth. People say here, and they feed you something, and you go. And if it's spaghetti, say it's spaghetti or noodles or something, you go, and you eat it up, right? So what happens is you bite your lip because your mouth is numb. The brain forgets the left half of here, of the shoulder, of the ear, of the neck, of the stomach, the leg, the hand, the fingers. Um, so there we go. Um, so I'm just going to adjust that there with my foot. So yeah. So let's see what happens. Is everybody seems to overcompensate for you. They say, "Oh, you're holding yourself," and they hold you so much that they 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 have like you have a tendency. Everybody goes, "Oh, take it easy, man, take it easy," and they hold you, and it's like just let off, just leave me alone, because if you don't just get left alone, then you can balance yourself. Your brain can balance, with the inner ear, with the right ear, with the left ear, you don't really hear so much. So with the left eye, I don't know if you can see my left eye. My left eye is a little bit teary, and of course, it doesn't actually moisten. So my left eye itches, and my left ear itches. My left nostril itches. There, my left nostril itches. So, um, yeah, lack of everybody wants to compensate for you, and you have no balance. So one of the things that happened is that I noticed that it is in the hospital. There is much stroke, and there are a lot of it. There is stroke dementia, and I totally understand it because you're looking at somebody like you look and you see some things. They took me down in the basement and they took me across the way and like down in the basement and into the CT scanning room, and uh, so what happens is you have a like you cannot speak. Your speech is not. You can only, like I said, the S's. I only was chirping S's, and the, one of the things is that the hospital staff, they'll look at you like you're demented. They look at you like you're crazy. So when you can you just let go of me, please? Thank you. They look at you like you go, excuse me, and they go, what? And that's exactly how they look. So you go, like, can I have you got my glass of water? And she goes, huh? What? And uh, um, Like they look like they act like you are demented. Like one of the things that happened was I had an IV that was taped by a piece of tubing. Piece of tubing was taped to my arm, and she was, they go out loud. They go, "Oh, excuse me, sir, sir. Yes, um, look, here's what's gonna happen is we're gonna give you an IV. Oh, don't touch that." And she grabbed my hand and she pulled my hand away, as to not allow me to remove the piece of tape from my arm. And I was like. But anyways, the big thing is that they kept speaking and they kept speaking loudly, and I turned around and I yelled. I mean, I hear quite well. Thank you. But anyways, like I said, looking like a stroke patient, you look like a little bit demented, a little bit weird, and these people, they obviously act like they don't. They act like you're. Look at her. Seeing the color compensation if I put the head down and then put the color up. Well, then you see you can see the color compensation go up. So yeah. Anyways, that's what happened. So what I'm gonna do is I'm gonna take my left arm. I'm gonna move it up here on the couch. I'm gonna sit it here. I'm gonna have to lean over. Sorry, lean over. I'm gonna have to lean over. Right, so I'm trying to lean over, and everybody's trying to grab me. So I don't really don't want to be grabbed, and what that is that it is. What do you do if somebody bugs you? You retaliate. You know, like they you're in the here you are, you're in the operating room, and they put such things as blood pressure cuffs and whatnot on your arm, and what they do is they continue to like they said, oh, we want to transfer your IV, like move your IV from your left to the right, or sorry, from the right to the left, and I went, no. What happened was there was at the bottom of the bed there was these bed rails, and they were like a bed gate, and what happened was, I said, can you lower that bed gate, please? And they said no, and I said, why not? And they said, oh, well, because the hospital says you're forbidden. And I said, well, by whose authority? By whose frigging authority am I forbidden? So I called my lawyer, and I called the Canadian Embassy. I called the advocates for, my health and my safety, and like they said, we'd just be held liable, otherwise, right? So, yeah, like I said, I feel a little bit confused at sometimes, but these people, they look at you like you're very confused. They see that you're, that you can't really speak very well. Here, just let me sit up, please. I need to just lean forward. There, my back is no longer really sore, and I need to. I just need to pull my back forward, and like what happens is the inner ear on the head balances. So as soon as I get balance, then I know, then I know which way to move, and I can move quite easily. In order to be balanced and to be erect and to be like my shoulders this way and my spine this way. So, what happens is I move over, and everybody, like if you saw somebody move over in the store, and you saw them start to lean tip sideways, you would grab them and go, whoa, hold on, mister. Excuse me, sir. You would stand up, you would hold them up. And one of the things that happens is when you've got a stroke, the brain does not remember the left side, doesn't remember your left leg or your foot. Like you can wiggle your fingers, you can wiggle your hand. Okay, so I'm gonna wiggle. What I'm gonna do is I'm gonna lift my arm, and this is as much as I can move. So I gotta wiggle my finger. I gotta wiggle my thumb, and like I said, you see, these girls are pulling me forward. So it's very frustrating. It's extremely frustrating. But that's what happens when you get frustrated. Anyways, that's what happened was I got really frustrated at the hospital, and I said, "Well, by whose authority?" And I said, and blah blah blah, blah. I got blustered, and they I told them, I said, by my right side, I said, like my right arm, I'm powerful, and I said to the one lady, I said, you better watch out. I said, because like if you talk to me like that, I will break your glasses. Is what'll happen is I'll break your glasses off, because with my right hand, I could quite easily break somebody's glasses. These Filipinos are small, and I'm a big guy, and that's just a fact. So yeah, I noticed when I slept, I noticed them slapping and pinching my arms, slapping my arms and pinching my arms, and flicking the fins in my arms. And it was like, ooh, wow, this really hurts. When you've had a stroke, you see how everybody holds. So when you've had a stroke like this, see, I'm trying to move my hand. And when I move my head, everybody tries to compensate, and I really wish that they wouldn't overcompensate for me. It's something that everybody guard. They go, oh well, he's had a stroke, so I'm going to guard for him. I'm going to advocate for him. I'm going to make sure that he doesn't slip and fall and hurt himself, and that's what these people do. So what they do is, like I said, they what they did was they moved the IV from my right to my left. So as time went by, I had my IV lines in, and I thrashed about quite a bit, and I had my right arm quite dexterous. I don't know if you noticed my left hand, but there's no dexterity. I can't move my left hand, but I can certainly move my right hand. See, and everybody's holding me up there. So I'm gonna lean forward. I'm just gonna lean forward, and I want everybody to just
lean forward.
Just leave me alone. To lean forward, because what happens is your back, when you're laying on your back, if you sit on your back and somebody grabs your shirt or your shoulders, and then you lean forward, well, your back gets really sore. So like my hand and my arm is trembling because I keep trying to pull forward with my Chesterfield, with the coach. So yeah, these people seem to think I had stroke, and so we'll just start again. So what I had was an ischemic stroke on the right side, which caused my left side to be impaired, and see, I'm shaking. See, my hand is shaking. But I tend to compensate. Like I'm holding this couch, and I'm compensating, whether I'm leaning or moving, and what's happening is everybody grabs my shirt and I'm pulling back. So rather than pulling back, I'm pulling forward with my hand, and my hand is very tired. So, anyways, like I said, these people they think you're crazy. The one fellow, they had me on the occupational therapy, and they had me stand up on a walker, and the walker had 2 rubber handles, and the guy said, okay, he said, here, stand up here and put your hands here. So I put my hands there, and I stood up and I moved my hand. I put my hand near the walker, and I just put my arm, leaned my arm against the handle of the walker, and he went, oh no, and he pried my hand, pried my fingers out, pried my hand, and then he slowly moved it forward, and put my hand there, and he says, here's where you want to leave it, here's where you want to put your hand. Like he pried my hand out, like it was like, okay, well, we'll see you later. So he pried my hand out. He pried my hand away, and it was like, I said to him, I said, you know, just so that you know, I just want you to know that I'm really paying attention to what you're saying, and I can do what you're asking me to do, but whatever. But what's gonna happen is if 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 I really can, I'm like if you really like I'll get really angry at you, you know, so like don't lie to me and that sort of thing. These people are all like, like I said, they speak to you like you're in dementia. You're in the you're in the throes of dementia, and it's wrong. So the worst thing that can happen is I actually looked at the stroke. There's demented stroke. There's stroke. People can't speak, and people can't recognize things, and they can't recognize people and who they are, and they can't see things, and they can't recognize things. So like, if they say, okay, what is this, and you look at it and you say, well, it's a plane or it's a car, but you look at it and you go, oh, I don't know what it is, right? And that's what I'm seeing is in the eye of my camera, but having a stroke like this is very belittling and very demeaning. That's one of the things is that like they say, okay, sir, okay, sir, what we're gonna do, we're gonna change you, and you go, oh, great, that's fucking A, that's just right on. Yeah, that's not what I want. So, like I said, you look a little bit demeaned and a little bit belittled, a little bit embarrassed, and there's not much you can do. But when people, when I think about it, if you see a man or a woman, and you're absolutely naked, and somebody rips the bed sheets off you, they tear it off you, and you go, oh, you hold the pillow up to your private parts, or you just you like women hold their hands against their breasts, or holds their hands against their pubis, or whatever else, and the reason is just because it's embarrassing, and you would think that it was, but these people are demeaning and embarrassing and belittling, and they just go, oh, these guys are like, because the thing about it is that they can lie. They can lie. They can say, oh, well, the guy is demented. The guy doesn't even really know. If I go and say, oh, that lady took my clothes off, and the lady goes, oh, well, he's good. He's a stroke dementia patient, right? So, okay, so that's what you get. You don't get any of that. However, all your reasoning, and one of the things that happened before I got the stroke was, I thought, okay, what am I doing here? Like, what am I gonna do? And where am I? What's going on? And yeah, see, this overcompensation just absolutely blows. But yeah, it's really disgusting, and the Filipinos, they call it what do they call it? They call it. See, this is what I mean. Is I need my memory, but they call it. Bastos. These people are bastos towards a person. They're very rude and ignorant and mean, nasty, but they're hospital patients. They're hospital people. And the thing that happens mostly is that they, like I said, they you go, oh, that news hurt me, and they go, well, he's just a dementia patient, like, so, so if a crazy man hits you, or sorry, if you hit a crazy man, and he was crazy and he didn't know who you were, and they'd say, Okay, well, who hit you? And you go, oh, well, and you don't know the name of the person. I don't know. I don't know the name of the person. And they go, oh, okay, well, he's crazy, right? So that's the big. See my hand? You see how my hand is shaking? See how my hand is shaking like this? Like it's because my hand just shakes because I'm pulling forward, and my arm is shaky. Like if you've ever laid on your arm and you're watching TV or something, and your arm shakes because the muscles are really contracting hard, so your hand shakes. But this is what happens is that my hand keeps on shaking. Yeah, so that's what the name of that. And I could talk a little bit more, and I could make it sound like people here were um, um, very rude to me, and I could make that sound like, but I would just say, these people are just like if you look at the hospital reviews in the Philippines, people will say, you know, like and basically what they say is, they won't advocate for me because they don't know, right? Like there's an example, like a truck smashes into a car, and they say to the driver, like, what happened? The driver says, I lost my brakes, right? So like when you get a driving lesson, one of the things they tell you is always check your brakes, always check your brakes, always check your brakes. Wow. Okay, so here's a question: who loses their brakes? How many trucks lose their brakes? You know. So who lost their brakes? So there's the overcompensation. But anyways, yeah, I sat here very very angry a couple of nights ago. I laid here very angry. But one of the things I'm gonna do is I'm gonna make myself a video, and that's the long and the short of it. So so you can you can hear the expression that the Philippine people don't like. You can tell a joke. So one of the things that happened was I told my girlfriend a joke. I said, okay, look, here's a guy and here's a donkey, and this is what happens, and that's what happens. So then I tell the joke, and I go ha ha ha, and she goes oh ha ha ha, and she laughs. But there's no um nobody gets anything. Nobody gets what nobody gets. You know the the like there's a Swedish word where the guy says, he says, I would like to, you know, the one of the sayings is, the tongue is in the wrong mouth, and it's like, I can get it, but people would say, oh, well, the tongue is in the wrong mouth, oh, and they wouldn't even understand that, but that's just because people don't really like. This traffic enforcer guy. He said, "You're a nice guy," and I said, and he says, "Your wife isn't." And I said, "Oh well, I was trying to be nice, right?" And I said, "Well, you you catch more flies with honey than you do with vinegar." And he goes, "Yes," and I'm like, you know, he didn't even understand. But I'm just gonna lean forward. I have to lean forward while my back to rest. there. So one of the things to resting my back is pushing my hips forward because because I'm balancing. See. Okay, we just get it off there, please. But that's the whole thing. It's just please
You
just.
don't want me to hold you? Why?
No, I don't. No, I don't. Why? Well,
If you
because
fall
I
down,
don't.
it's not your problem, it's my problem.
Yeah. I don't want you to hold me because I really because why the answer is because I don't want you to hold me. That's what the answer is. I don't really know what the answer is. It's funny, people say, I say, well, can I borrow that telephone off you? And they go, why? And I'm like, well, because I just want to borrow that telephone off of you. Because they don't understand. Like they question why. Like,
Uwi ra ba na siya?
yeah,
Ano siya? Okay.
I don't know what you're saying. But my arm is, see, look at my hand. It's just shaking. So I'm gonna move this camera over. Oh, okay, easy. Okay, no, just don't grab it. Okay, just don't grab it. Okay, just don't grab it. Please don't grab it.
Dahil siya.
I don't know where it is. I don't know where it's at. Okay, so hand me back my camera. Please hand me back my camera.
Wait. Hino siya matanggam. Oh.
So
Oh.
that was a little bit of a.
You don't want anybody to hold you?
No.
Okay. Go.
I really don't want anybody to hold me. So that's the whole thing, eh? So you don't want to help yourself? Okay, well then fuck you.
Fuck you. Don't say fuck you. We're trying to help you, but you say fuck
Can I
you?
have that coffee?
No. Fuck you.
So that's what you get. Can I have that cup of coffee, please?
No.
Why not?
So rude. What kind of people are you? We're trying to help you, but you're so rude. We're trying to help you, but you're so rude.
I just want to say the person that wants a cup of coffee.
So you need somebody to make your coffee. So
Yeah.
why you don't when we
watch
hold
out.
you, you don't like to
Just watch out. Just watch
don't
out.
say that you don't need anybody. You need anybody,
I just need to lean.
or you just don't need me.
I just need to lean. Yeah. Okay. So there's another one is that when your arm or your leg, when they come back to life, so to speak, like if you've had your arm fall asleep before, and you've laid it all on it, and say your arm is woken up and it hurts. So what happens is my left arm hurts, and my left leg hurts, and my neck hurts, and my back hurts, the left side of my back. So
You're shaking now.
yeah. all I can do is move myself here. So just move this. See, they're just not opinions. Just please just let me go.
Oh, go. I'm
Just
ready
stand
to
up
wait.
and sit. Just let me sit here.
Okay, you cannot do that yet. So now, we're not in hurry. We're not in a rush. Just make things like level by level. Not so hurry. Okay, you lie down. You back down. Not in a hurry. Okay, ha? Just stay there. Don't stand, ha? Don't stand. Just move, please.
No.
Stand. Lay down back. Lay down back. Because we need to rest. We need to rest now, please. Okay, push. She will be back there. Push again. Okay.
You want a camera, please.
Yeah. Push. Push, please. Push your feet. Your feet. Keep
It's
push.
okay.
It's okay.
It's okay. Like I said, my arm and my leg really hurt.
Okay.
So my neck really hurts. The left side, my neck really hurts. Okay, so. Please hand me the phone. Sorry, please hand me the phone. Thank you. Yeah, so there I am. One of the things that happens is you lose the speech, so the left side of my face, like it it has no my cheek. There's no like it feels like there's like I've lost my teeth because I'm using the words th like and my left tongue is weak. So anyways, yeah, like I was saying, when you fall asleep on your hand or in your arm, and your hand seems to come awake, you know that painful pins and needles feeling, and if you move it really hurts. Okay, that's what's going on. There's my right foot. There's my left foot. So I can do very little with my feet, and as you can see, something else that's very belittling and degrading is the fact that in the stroke ward, they put a diaper on you, and if you fuss and fret, like I was saying to these people, I said, by whose authority? I said, what I want is I want my rights. I want this put down. And the girl said, we can sedate you. We'll call the police. Calling the police, and I went, oh, frig. Calling the police, what that means is they're going to handcuff me and shackle me, and they're going to sedate me. And then what they do is they put in the IV there's the IV. Right in my arm. But anyway, they just uncap the IV and they just stick the fentanyl or the cocaine or whatever it is in it. And they just go, okay, just relax. You'll be okay. You will be okay. And all of a sudden, yeah, I guess things are really okay. Yeah, like that was another thing is that the nurse came and I said, what is that? She said to me, she said, do you want to see the sky? And I went, no. I said, no, I don't. Notice the left side of my chin, the left side of my mouth. But I said, yeah, no, I don't want to see the sky. And she says, oh, come on, she says. And I said, no, I don't want to. Because what I did was I said, is that, in the IV there, I said, is that a sedative? And she said, yeah, it is. But it's it's not a sedative, but it is a, anti, um, it's um, not antivirus, but it's a antibiotic. And she said, but it is a sedative. And I said, oh, I don't want that. And she said, oh, come on, they just put it on. Like I said, they just hook it, they just screw it to your IV. And they just plug it in just like they're plumbing in propane into your motorhome. So I said, yeah, I don't want that. And she said, do you want to see the sky? And I said, no. No, I was very afraid because of all the stuff that was coming. Her having telling me that I could be sedated and that the police would be called. And I said, well, that's great. So what happened was I phoned the police and I said, help. I said, I need somebody to advocate for me. And I said the same thing with the lawyer. The lawyer said, whatever you do, don't sign any waivers. And, just, everything will be okay. Just calm. Just be calm. So, I said to the nurse, I said, so what is it that I do? And she says, you just have to lay here, sir. And she speaks loudly, and I just go, well, I just pulled the blankets over my head and closed it up. And yeah, it must have been a sedative, because you can see how far my words are working, eh? But it must have been a sedative because they I was very afraid, and they were very it's okay, sir. It's very fine. Like just you'll be good. It's okay. Just lay down. And like I said, I just pulled the blanket over my head and went, oh my goodness. Here I am. I'm gonna die. I'm gonna OD. But anyways, that's one of the things that I'm gonna do is advocate for stroke victims, because they do have like aphasia and that sort of thing. One is the inability to recognize things, and the other one is the inability to hear things, and one is the inability to speak. So when they don't speak, like there was one lady that had a stroke and she said something like 7.5, 7.5, 7.5 or something, just some number. And they said, so do you want your change? And she said 7.5, 7.5, 7. So like they would have just not known what she was speaking of. So that's a stroke. I call it a stroke victim, and they need to be advocated for. One of the things is that what you find is that you're very, very itchy once you had an ischemic stroke, you're very, very itchy. And we've got some recommendations that that you can use in order to not be itchy. But yeah, I got my back scratcher, and it's like, oh, my back is so itchy, and my legs are so itchy, my arm is so itchy, and my arm here, and my underarms are all so itchy. You know, my neck is so itchy, my head is so itchy. If you see me doing this, that's because I'm scratching my nose, scratching my forehead, I'm scratching some things that I can't help but to have scratched. But my belly, my ribs, my back along the side of my kidney, and my lung. You know, those are just my shoulder blades. So I have this back scratcher, and the people go, "Oh yeah, you can't really use it." I said, "No, why not?" And they took it away. And I went, "Well, why?" And they said, "Well, because what happens, you scratch yourself, and you'll get cut, and the cut will become an infection, sir." And I was like, "Oh my God, okay." So I just put points over my head. You know, like anything they said, "Well, you can't have it, you can't have it, you can't have this, you can't have that, you can't have all these things." I'm like, "Well, why not?" And they go, "Well, because, basically because they'll be liable. Like if you get an infection, because you scratched you scratched with a back scratcher, they'll be liable, right?" So, like the way they become liable is that they don't, okay, so there's huge amounts of billing, and you go, "Oh well, you guys are liable, and I'm not paying." Right? So, say for instance, you're gonna sue for 500,000, and they charge you for 500,000. You're gonna sue for that much, and then that's what happens to these people. Oh jeez, the hospital realizes that there is no liability. Yeah. So they won't.
Stephanie! There! Stephanie!
And that's my story, and I'm sticking to it. Here's a nice guy. Big kitty. Big kitty. Yeah, you. Yeah, so there you go. So one of the things they say is sulfur. You can use sulfur to stop itching on your skin from itching. So that's what I'll be doing is I'll be using sulfur. And something else that happens is like there's a diagnostic center, and like I said to my girlfriend, I said, is there an elevator up there? Can I go into an elevator? Because with my left side I can't do stairs. Right? I can't hang onto a handrail, and I can't do stairs. So if there's a wheelchair, we have a wheelchair. So what I could do is they could push me up the elevator. So up the elevator I go, and into the diagnostic center I go. That's just that's like I said, as I was saying, the way that I am speaking,
Your
now.
husband calling to her. Maybe you get jealous.
What's that?
Your husband calling
Oh
to
yeah.
Jen. Your husband. He talked to her husband. Maybe you get
Okay.
jealous.
Maybe what?
Maybe you get jealous.
I don't even understand what you're talking about. But what was it that I was saying?
You wants to have a physical therapy? There's somebody calling me from Chongwa. Go here.
How much? How much? Yeah, 700 pesos, right?
1,000 pesos. So you don't want
And tell
to...
him no, thank you.
Huh?
Tell him no, thank you.
Hoy,
So, oh, okay. Well, how about 750?
we have a schedule of Chungwa and on November 7 and November 14 and November 21 for our physical therapy in Chongwa. We go there. So do you don't want to be normal again? You don't want the therapy? Hmm?
Oh, I want to be normal again. Anyways, that's what's happened. Is
So
I've
we
had
need
an
a
ischemic
therapy. Huh?
stroke. So I said, so did you see the CT scan? And the doctor said yes. And I said, so what's going on? And an ischemic stroke is like a stroke where you have your uh, cholesterol. There's HDL and LDL. HDL cholesterol is quite high. She said, and the LDL cholesterol is normal. And I got a scratch here. What happens is the platelets, they call it, it's like cheesy type platelets, but they come in and they float up into the brain, and they block all the little arteries, all the little areas that are moving back and forth through the brain. So what happens is, they tell you to have oxygen. So what you really want to do is you really want to have oxygen, and the reason is because you've got these tiny little veins, filling your blood with oxygen, and you can breathe the oxygen, and what that does is that gives you more oxygen. Excuse me.
I looked at the
They
physical
can give you
therapy
more oxygen
Over, huh?
to the smaller parts of your brain than you get.
I let this physical therapy to go your hand. Okay?
Don't tell them no.
My God.
No. But yeah. So anyways, that's the whole thing. It's called ischemic, and you can just look that up on YouTube. Versus hemorrhagic, and what that is you have high blood pressure and the veins go when your brain explodes, the veins explode from your brain. But there have been fatty parts of the cholesterol that have gone into my brain, and they said it's quite large. It's very large. So what happens now is to rehabilitate myself. See, there, I move my hand. And I move my hand up. Oh, there. There. That's moving my hand up. So yeah. Something else you can do is you can do this. They can inject you, and you can dissolve those fatty bits of cholesterol. They call them cheesy. Like if you think about how cheese is, how it's kind of mushy. Well, that's like they can just dilute that, and those things can be diluted, and I can immediately regain, the stroke. Can regain all the components of my brain. What happened was I stressed myself hard, and by stressing myself out, like my blood pressure went up, and the cholesterol went into my brain. So, excuse me, something to be had. There's something to be said for checking your cholesterol. If they tell you that your HDL is high, well, that's the bad part. Because that was what the problem was that I had high HDL and intermediate LDL. So that's what they said. It's okay, but the HDL is very high. So cholesterol is like little bits of fatty globules in your blood. But that's what's happening. So I'm looking for somebody to advocate for me. I've called a few different people and places, and either they have or not. And would you be able to lift my leg up and put it on the couch there? See, because my left leg hurts, right? So, like, I pretty much have to remind. Could you please put my left leg up on the couch?
You need me?
Yes.
A while ago when I hold you, you don't. But
Yeah.
when she hold you, it's okay for you. But when I hold you, it's not okay for you. What's the deal?
Just put it on the couch. I don't know.
What's the deal?
The other leg. Just put the other leg like this.
Maybe we wait her to hold your legs.
No, can you just do the other one?
We wait for her because
For who?
you don't want me to hold your legs a while ago when you are sitting, and you let her hold your leg. But me,
Can you just
you like
please
me.
do that?
Don't. You told me go away. What's the deal?
The
You
things
trust
you do.
somebody else rather than me.
Yeah, there you go.
You trust him. You trust her than me.
I just would like you to move my leg up. Please.
We wait her.
No?
We wait her. He's talking to her husband. You don't want me to hold you.
Why?
You don't want me
Why?
to hold you.
Yeah, I know what's happened is that you have
You don't remember when you're
I
when you're
remember
sitting
every
there
time that
and I hold you and then you told me
reminding reminds you
go
to get
away,
coffee, get
and
coffee,
then
get coffee.
she hold you, but it's just okay for you. But when I hold you, just go away. Fuck you.
I see, there you go.